So, Dr. Gary, have you heard of Joe
Shy of living in a cave, I don't know anybody who hasn't heard of Joe Rogan.
Rogan?
He's got the most popular podcast around.
Yeah. So, did you see this?
Yes.
You
So
can
we're
take
what.
the photo.
So what we're talking about is a therapeutic plasma exchange that Joe Rogan had on himself, and what he's holding up is the albumin that was removed from him and replaced with clean, fresh albumin and saline. So he's showing you what this kind of a darker color amber of albumin that is moving toxins and inflammatory factors from this body. I think one of the things I get concerned about with the health span field and what we're doing is overpromising and underdelivering. There is no question that therapeutic plasma exchange can be helpful in reducing inflammation in your body. There is also evidence that doing therapeutic plasma exchange can give you a biologic setback. That means that doing regular plasma exchanges on you, we have actually measured biologic clocks where we see that you're about 2.5 years younger after about a half dozen exchanges, along with IVIG, intravenous immunoglobulins, that actually make you younger than your chronologic age. I think all of that is very important information. I do TPE myself for that reason, okay? But I think we also want to be careful not to oversell it. We want to make sure we know why we're doing TPE on you. It is a legitimate therapy. It is an expensive therapy. And I think a lot of people can benefit from it in terms of helping their immune system. Can it remove plasticides and plastics from your system? Not so much. Our filters are not that good. Can it remove immune factors and a lot of inflammatory factors from your body? Absolutely. Can it remove mold toxins from your body? No. We don't have the filters to do that yet. We are in the process of having that pass through FDA approval now, and hopefully in the next month or two, those filters will be available and we will be able to remove mold toxins as part of the therapeutic exchange. But the real factor we want to keep in mind is this is a medical procedure. It can do a great deal of good. It's really not particularly dangerous, so it's a fairly safe procedure to do. But I want to make sure that if you're going to spend this much money on a procedure, that we have the highest possible odds of helping you and seeing you benefit from it. So I want to make sure that we're not overselling this so that it falls into disrepute, when in fact it's an extremely important and valuable therapy. And so we need to be thoughtful about it as we're using it and what we're doing for it. Does it have a place in healthspan? Yeah, it does. It can, in fact, do that. But it's not just one or two treatments. You have to do a series of treatments, and you have to do IVIG with it, intravenous immunoglobulins with it, to get the most benefit. At least that's what the studies show. So if we're going by the data, that's what the study shows. So we don't want to overpromise and underdeliver. That's the worst thing I think we can do, because it'll put very good therapies into disrepute because people were not paying attention to the proper use of them. So for Joe Rogan, I think you do a marvelous job in terms of getting a lot of information out to people that need to hear it. I also want to be very careful about not overpromising and under-delivering. We have tested a lot of these longevity tests. I was going through one epigenetic test the other day with a company, and what they came back with was a lot of information that said my patient was very sick. I already knew my patient was very sick. I asked them if they could give me further direction in terms of how I could help this patient versus what I already knew. And the answer was no. So was the test useful for me to do on this patient? Actually not. It didn't give me any more data than I already had by doing conventional testing. So if I'm doing this testing, I want to make sure that I'm getting actionable data from my patients. I want to make sure that we actually are able to help people with the information we're getting. So Joe, please, what I want to see doing is making sure that we're not setting expectations too high and we're being very thoughtful and careful in explaining to people what we can and what we cannot do with healthspan.